Anorexia can have various effects on the body and mind. Some of the physical effects are low blood pressure, slowed heart rate, damage to organs, infertility, anemia, poor circulation, gastrointestinal problems, and hair loss. Some of the psychological effects are obsessive and distorted views about body shape, fear of weight gain, low self-esteem, depression, self-harm, emotional withdrawal, and anxiety. Let's take a closer look at some of these effects and how they can impact your health and well-being. Low blood pressure and slowed heart rate are signs of malnutrition and dehydration. They can lead to fainting, dizziness, fatigue, and weakness. They can also increase the risk of heart failure and cardiac arrest. Damage to organs can occur when the body does not get enough nutrients and oxygen. The brain, kidneys, liver, and bones are especially vulnerable to damage from anorexia. Anorexia can cause your brain to shrink, affecting your memory, concentration, and mood. It can also alter the chemical signals that regulate your appetite, happiness, and harm. Anorexia can cause kidney failure due to dehydration and electrolyte imbalance. It can also cause liver damage due to starvation or excessive use of laxatives or diet pills. Anorexia can weaken your bones and make them more prone to fractures due to low calcium intake and loss of estrogen. Infertility is a common consequence of anorexia in both men and women. Anorexia can disrupt the normal functioning of the reproductive system by lowering the levels of sex hormones such as estrogen and testosterone. This can cause irregular or absent menstrual periods in women and reduced sperm count and sexual drive in men. Anorexia can also affect fertility by causing weight loss, malnutrition, stress, and psychological distress. Anemia is a condition where the blood does not have enough red blood cells or hemoglobin to carry oxygen throughout the body. Anemia can cause pale skin, shortness of breath, chest pain, headache, and cold hands and feet. Anemia can result from anorexia due to inadequate intake of iron, folate, vitamin B12, and other nutrients that are essential for blood production. Poor circulation is a problem where the blood flow to certain parts of the body is reduced or blocked. Poor circulation can cause numbness, tingling, swelling, pain, and skin discoloration in the affected areas. Poor circulation can be caused by anorexia due to low blood pressure, dehydration, electrolyte imbalance, and damage to blood vessels. Gastrointestinal problems are disorders that affect the digestive system such as the stomach, intestines, liver, pancreas, and gallbladder. Gastrointestinal problems can cause nausea, vomiting, diarrhea, constipation, bloating, gas, abdominal pain, and acid reflux. Gastrointestinal problems can be caused by anorexia due to irregular eating patterns, starvation-induced changes in digestive enzymes and hormones, laxative or diet pill abuse, and binging and purging behaviors. Hair loss is a condition where the hair falls out more than normal or stops growing altogether. Hair loss can affect any part of the body but is most noticeable on the scalp. Hair loss can cause thinning, brittleness, dryness, and bald patches on the hair. Hair loss can be caused by anorexia due to lack of protein, zinc, iron, biotin, and other nutrients that are vital for hair growth and health. Obsessive and distorted views about body shape are cognitive distortions that involve having unrealistic or negative beliefs about one's appearance. People with anorexia may perceive themselves as fat or ugly even when they are underweight or normal weight. They may also focus excessively on specific body parts or features that they dislike or want to change. Obsessive and distorted views about body shape can be caused by anorexia due to low self-esteem, social pressure, media influence, genetic factors, and changes in brain structure and function. Fear of weight gain is a phobia that involves having an intense dread of gaining weight or becoming fat. People with anorexia may avoid eating certain foods or calories, exercise excessively, use laxatives or diet pills, or vomit after eating to prevent weight gain. Fear of weight gain can be caused by anorexia due to low self-esteem, social pressure, media influence, genetic factors, and changes in brain structure and function. Low self-esteem is a negative evaluation of one's worth or value as a person. People with anorexia may have low self-esteem due to various factors such as childhood trauma, abuse, neglect, bullying, rejection, criticism, or failure. Low self-esteem can also be caused by anorexia due to obsessive and distorted views about body shape, fear of weight gain, depression, anxiety, and isolation. Depression is a mood disorder that involves persistent feelings of sadness, hopelessness, worthlessness, guilt, or emptiness. People with anorexia may experience depression due to various factors such as genetic predisposition, brain chemistry imbalance, hormonal changes, stressful life events, or trauma. Depression can also be caused by anorexia due to low self-esteem, obsessive and distorted views about body shape, fear of weight gain, malnutrition, organ damage, and social withdrawal. Self-harm is a deliberate act of injuring oneself physically or emotionally. People with anorexia may engage in self-harm behaviors such as cutting, burning, scratching, hitting, or biting themselves as a way of coping with emotional pain or expressing negative feelings. Self-harm can be caused by anorexia due to depression, anxiety, low self-esteem, obsessive and distorted views about body shape, fear of weight gain, and guilt or shame. Emotional withdrawal is a state of detachment or disconnection from one's feelings or emotions. People with anorexia may withdraw emotionally from themselves or others as a way of avoiding or numbing their emotions or protecting themselves from being hurt or rejected. Emotional withdrawal can be caused by anorexia due to depression, anxiety, low self-esteem, obsessive and distorted views about body shape, fear of weight gain, and isolation. Anxiety is a feeling of nervousness, worry, fear, or panic that interferes with one's daily functioning or well-being. People with anorexia may experience anxiety due to various factors such as genetic predisposition, brain chemistry imbalance, hormonal changes, stressful life events, or trauma. Anxiety can also be caused by anorexia due to low self-esteem, obsessive and distorted views about body shape, fear of weight gain, malnutrition, organ damage, and social pressure.